One tiny stone?
Yeah, that was it. And he said didn't look infected or didn't look anything like that. Now, so how was your appetite?
It seems to be getting a little bit better. Well, don't remember.
Okay. All right. So in the meantime, I keep getting a lot of, negative tests, like Q fever negative, a lot of serologies, like lupus testing and similar diseases, all came back negative. So they're normal. Lyme disease came back negative. And what else? I just saw something. Wrote it down somewhere. Oh yeah, so about half of what we call a fungal panel, for serologists for different fungi and molds. Half of it back and half of it is negative. So far as I didn't find anything, so other than blood clot. Now Dr. Mohan keeps you on a little bit of antibiotic. I'm not sure whether it does anything or not.
Hello?
Yes. Yes. All right. Now,
Yes, but the doctor's in with him. Can you call back?
yeah, so there is very few tests that I'm still waiting. So one of is not what not back is half of fungal panel. Of course, the whole culture sitting there, but they did biopsy. They had nothing on this biopsy, just inflammatory cells. What you expect when somebody had a blood clot. They didn't see any definite malignancy or anything. Okay, so that I saw. Now, your culture is not growing anything, but as I said, you need probably to tell that they indeed negative. So they did a week ago. You don't need to wait another 2 weeks before you tell that it's a final result, they're negative. And the last thing you might consider, so to give to finish work, it's probably, so maybe to consider bone marrow biopsy. So that is the only, so that's the only thing that can be considered. So as a part of workup. Because you have a touch of anemia, nothing bad, but we'll checked everything else. We know that head is fine, so we know that there's nothing in your abdomen that was concerning. There's nothing, else. You already had upper endoscopy, lower endoscopy, colonoscopy and upper endoscopy, CAT scans, MRCP and ERCP. So it was stone, nothing else, so it seems to me. And I don't see any evidence of infection anywhere else. So I suppose that from my standpoint of view, I'll just not sure they keep you on a little bit of oral antibiotics, but I'm not sure you need them at all. So at least it's not my recommendation. So they think that maybe you had a blood clot and a little bit of pneumonia, but you never grew anything and you get already a week of antibiotic before that. So that's more than enough. But if you to consider bone marrow biopsy for the sake of completion, maybe like fever of unknown origin. So that is that is fine. Another approach would be, just to treat this blood clot, wait another couple of weeks till all cultures come back, and if it's still you have some problems, then do bone marrow biopsy. So one or the other.
Now they say that bone marrow biopsy is very painful. Will he be asleep for that?
So they numb the spot. And it's really exaggerated. It's not that very. So it's not that painful when a person is numbed properly. It's quite common procedure. I saw, like either young people, old people, really old, frail ladies in their 80s have it done, and I never heard them complain too much. Every now and then, if it's not numbed properly, it can be painful because you have to go through the bone. But I would say 99 people out of 100 tolerate it just fine. So but I'll talk to your doctors whether they would consider it now, and maybe they need to get something like a hematologist consult to get his opinion, because that's who does bone marrow operation, like hematology, so hematology consult.
So they would do that before he's discharged.
And so I say it's something, so you might consider. Not saying that you have necessary to do it right away, because it's out of, so it's not an area of my expertise. But it just, sometimes I participate sometimes in workup of, fever of unknown origin, and even if I don't see any evidence of infection, so there are no clear evidence of malignancy at this point anywhere, my recommendation is, maybe you can do bone marrow biopsy because you have a touch of anemia and you have a condition called macrocytosis, and you have it's maybe all related to folic acid deficiency, but I consider to make sure there's nothing going on with the bone marrow. So that is.
Well, if there was something wrong with the bone marrow, would that not interfere with my production of blood cells, red blood cells?
Yes, and that's what I'm saying. You have a touch of anemia, not very significant, but very mild. But you do have it.
Okay. Well, that could also be attributed to a lack of nutrition, couldn't it?
So that definitely lack of nutrition, and you had, a little bit low folic acid level. That can explain.
Right.
So what I said, it says something to consider, because, so that it still a little bit baffles me, because all kind of, these fevers and pain and everything, yes, so I can attribute it to the blood clot. I have no problem with that. So, but why you had this night sweats, or, or you didn't have any appetite and weight loss for about a year and a half, I still don't know. I don't have an answer. So I more often than not, I expect that there's something really aggressive going on that I would see.
Oh, hi.
Yes. Hey.
Glad you're here.
Yes. No, just nothing really coming back positive, so to speak. So the more tests we do, the more negative results we have. So, and I was saying, Mohan, antibiotic, I don't know what it accomplishes there.
Right.
So I don't know. I have to talk to Dr. Mohan. He said, what exactly you treating?
Yes, my question was, if we were, treating a lung abscess, we would probably go more something like amoxicillin or.
Yeah, like something like Augmentin and whatnot.
Right.
That's why,
Right.
so there's no evidence. He was wrong. He doesn't have, white blood cells count. He doesn't even have left shift.
Right.
To tell that it's lung abscess, so that's a really a stretch.
Right.
At least, I don't feel that way,
Right.
that it is a lung abscess.
Um,
He had even biopsies, and they never saw any kind of pus there, so to speak. No, so the last thing, well, all this fungal serology that keeps coming back negative, the half of fungal panel is not back yet, but it's only aspergillus. Now aspergillus grows really easily. If it were aspergillus, we'll probably see it, and he would have also, on top of everything, he would have something like eosinophilia. So I suspect.
Dr. Vera did say that if everything in the lung came back negative, he would consider doing the US just to double check the pancreas.
Yeah, so US is fine, and lung came back negative, of course, so that always makes sense. But other thing, the only test which wasn't already done, something like bone marrow biopsy. His anemia is very mild, and he definitely had nutrition deficiency. Now, how informative it will be, that's a big question. You can get hematologist's opinion on that. Because it's still, so I don't quite get how to put it. Well, let's say so, okay, he had pulmonary embolism, and he had this cavitary lung infarction, cavitary lesion and pain. So, well, I understand that. So that can explain, fevers at this point and everything. But it doesn't explain why he was losing weight for a year and a half. And where else are you going to look? Where else are you going to look? He had upper endoscopy, lower endoscopy, ERCP, MRIs, head CT, chest, abdomen, pelvis, so everything. Now, on the other hand, generally, so if you have something going on for a year and a half, it should manifest more than that.
Right.
So we will find some manifestations, so like, for example, this tumor, where it is, tumor usually doesn't say microscopic for, but again, so, you know, that I just don't have an answer. I don't know. So all infections I could think of, I checked for, but it's still, of course, you know, you wait if there are any kind of AFBs or, you know, mold will grow from aspiration, but yeah, so aspergillus grows quickly. It only gets 7 days. Something unusual, but what? I don't know. So what so AFB, he would have more respiratory symptoms with AFB. It's not an acute process. If you're growing big cavitary lesion from AFB, so usually coughing and, you know, have some problems for months and months, not just, you know, for 2 weeks. Doesn't fit any kind of, you know,
I just want to
known
go to
pattern.
lunch.
Doesn't fit any definite pattern. So if you guys want to get a hematologist consult, that's the only thing I could think of, and that's a lot thing that wasn't done. Whether it would be informative, but we'll get their opinion, and they're pretty smart people, and at least they, you know, so they deal with malignancies all the time too, and in their opinion. So did we do everything we could for, you know, so to rule out any malignancy, or there is something else we didn't do yet? So
That's about the only thing that happened.
yeah, I think that I just can't think about anything yet.
And I'm inclined to stop the septum.
Yeah, so well,
Okay.
so I talked to Mohan about that, because if she is really, you know, bent on treating it with an abscess, at least, you know,
I
she
think-
might consider
I don't think it was
using
that.
something else.
I think the ERCP commented on something in the lung, and that's why she started bleeding. So I don't think we need to do that.
No, so I think so. If there isn't, we need to find what it is before we treat it, because there is clearly, you know, other explanations for his lung symptoms. If he didn't have anything else, if he didn't have a blood clot, I would say yes, let's give broad spectrum antibiotic for a couple of weeks. But we have clearly a blood clot and infarction there. All right?
All right, thank you.
Thank you.
You want to go get that stuff done, that's fine. You got a lot of discharges.
Okay.
I can. Yes, go ahead. Go ahead. Do you understand what he was saying?
Did I understand what she was saying? Anyway, he
What
was
he
saying.
was saying?
Let her explain with everything.
Do you understand? Okay. What he was saying was that he's puzzled, and, you know, he's an infectious disease specialist.
Right.
And what he's thinking is that he has an explanation for what's going on in your lung just from having the blood clot there.
Mhm.
Now, and sometimes people get blood clots that go to the lung for no particular reason. I mean, sometimes it's associated with other stuff, but sometimes it just happens out of the blue. So, you know, I think we're kind of looking, and that may be a part of everything that's wrong with you, or with whatever's wrong with you, but that may be kind of a separate issue. And he doesn't think there's any infection in your lung, and we're looking for kind of weird things like fungus and, you know, things that don't normally, that we don't normally have. But it may well be that everything with your lung, with pain, with all of that is just related to the pulmonary embolism. But the problem with that is that it doesn't explain why you've been losing weight for a year and a half. And it's unusual, you know, everybody's always worried about cancer and malignancy and that kind of thing when you hear about losing weight. It's really unusual to have somebody losing weight for that period of time and not have a sort of obvious reason when we start doing all these tests. Usually by the time you've been losing weight for that long, it's pretty obvious, and we're not finding anything, you know. I mean, I think the stone in the bile duct, it's possible to me that could have been affecting your appetite, but I really kind of doubt it. And Dr. Vera doesn't really think that was the reason for it.
Yeah.
Sometimes you can have, you know, a kind of tumor in your pancreas that can cause problems, and there is one other way to look at your pancreas called an endoscopic ultrasound, where basically they go down with the light scope and they look with an ultrasound at the from the inside at your pancreas, and that kind of would lay that question to rest, because pancreatic things can can cause a lot of weight loss. But, you know, usually, again, that doesn't go on for a year and a half before you can figure it out. So, I guess we're still very puzzled. The only other thing that Dr. Cordova was talking about was that, you know, occasionally you can find something in the bone marrow that's causing a problem like this. We know that you were, you know, a little bit anemic and that your folic acid, which is a vitamin, was low, and that may have explained all of that. But do we need to maybe have the hematologist, oncologist take a look at you and see if they have anything else that they're concerned about? Now, you know, I kind of came onto the scene a little bit late, but over the last year and a half, when you've been losing this weight, it's been mostly a loss of appetite, is that right?
Yeah, I just didn't want to eat anything.
Yeah.
I was just not hungry, no appetite. And
What-
I would have to force myself to eat what little bit I did eat. Now, I'd eat
Yeah.
3 or 4 bites of something, and I felt so full I couldn't eat no more.
Okay.
And I was like stuffed. If I eat any more, I'm gonna throw up. I can't hold no more next,
Yeah.
you know? So-
And you haven't, how's your mental outlook been? Have you had any depression or anything over,
No.
during, anything stressful going on in your life or anything during that time?
No. The only stress we had really was the losing Chaco and Blondie. That was a big stress on us.
What was that?
Losing Chaco and Blondie, 2 of our children.
Oh my gosh. What happened to them?
One of them died of lung cancer, the other one died of basically constipation, got stopped up and couldn't get her to the vet in time.
Mm.
Couldn't get her there in time.
Yeah.
I still hold myself responsible for that. I
Yeah.
should have moved her sooner.
Well,
But,
can't always
Sunday afternoon, it's hard to get a vet to
right.
show up anyway, so.
Well, let us talk with Dr. Vera, and if you'd like for us to have the hematologist come take a look at you, we'll certainly do that.
But
Alright, we're
I've
looking
had-
at the hematologist, we're looking at an ultrasound, and the last resort, the bone
Transfer.
marrow.
Right. Well, the hematologists, they're the ones who do the bone marrow, and
Yeah.
we're gonna get an opinion from them about whether they think we need
First,
to do that.
yes.
Yeah.
And then the ultrasound. And then we
Yeah.
had talked about if everything else is negative, we can transfer, do an outpatient referral with Dr. Mohan or whatever you guys wanna do.
Yeah. I mean, I think, we've looked at the lung from the inside out in kind of every way we can, and all it's coming down to is that it's from the embolus. So,
It may be just simple as that.
it may be as simple as that, but that doesn't explain all this, what we call early satiety and loss of appetite and that kind of thing. So,
Well, since now, it may be strictly due to me taking the Remron, or maybe the Remron is helping, or maybe I'm getting where I don't need the stimulus for an appetite like I was needing before.
but you're eating better?
For me, compared to what I've been eating,
Mm-hmm.
I'm eating 10 times better than I was.
Okay.
Not that saying a whole lot, you know, if you're used to eating 1 teaspoon a day and now you're eating 10 teaspoons a day,
Right.
that's not a lot of improvement, but it's a big
It's,
jump from what you've been doing.
Right.
And I ate that whole, egg and cheese omelet
Yeah.
and most of my grits and what else did I eat? I ate about 3/4
Steak,
of my
pretty
biscuit.
good this morning. Okay.
And then I stole some of your, gravy biscuit and,
Yeah, he's eating a lot better.
Okay. Well, maybe we just need to
maybe that if I
quit
get.
trying to make it difficult. Maybe we just need to kind of
If I
treat
get-
pulmonary embolism and wait and watch for a while.
if
But I
get
think
my-
that, I do like the idea of the ultrasound, the
Okay,
pancreas. and-
okay. All right, we'll talk to Dr. Vera about that.
Okay.
Okay?
Alright,
Thank
thank
you.
you.
Uh-huh.
So I'm just wondering if I should, you know, if I get to eating some more, get some fat back on me, you know, get me some stuff, building blocks to work with, get my strength back, I might, you know,